So, hi and welcome to the WCN, the World Congress of Nephrology in Yokohama, Japan. And we're so pleased to be here as patients. My name is Manvir Victor. I am the current president of the Patient Liaison Advisory Group. So we've got a global group of patients. And in the studio here, there's a really nice, cute little studio in Yokohama. We have got a couple of those patients here with us. To my left first, we've got Serene Mai. How are you doing, Serene?
Hi, I'm doing good. Thank you.
And you're from Singapore?
Yes.
Okay. And so we're going to share with you our stories and why we happen to be here, sitting here as patients. And right across me, we have Nicole Scholes-Robertson, all the way from Australia.
Yes. Nice to be here.
Yeah, and this is great because when the WCN happens and, we've got a culmination of people coming from so many countries. We've got about 6,000 participants here, delegates here. And I don't know how many patients.
I've counted 13 that I know of. 13? Wow. Yeah, I've counted 13.
Yeah. So we thought we'll sit down here, have a quick chat about, why is it we're sitting here? What is it we do? And, what are our opinions on our doctors and our health systems, So I'm going to go to you, Serene. Tell us a little bit about your story and from Singapore. How did you end up in Yokohama?
So I was diagnosed with lupus nephritis since I was 9 years old. So throughout my childhood was very different from the rest of my friends. So at the age of 13, my immune system decided to attack my kidneys. So along the way, it has attacked other parts of the body as well, but the kidney was the most impacted, right? So I actually went through a lot of treatments to control the lupus. So along the way, I've gone through like chemotherapy-like treatments. So I've lost a lot of hair. I've had steroids when I had moon phase, and along the way, as my lupus was controlled, but because the lupus attacked my kidneys, so I had chronic kidney disease. So for a long period of time, for about 20 years, before my kidneys finally failed. But before it failed, I have a daughter. So I had her when I was 29. So at that point of time, I think the pregnancy stressed my kidneys. And the kidney disease just progressed. Yeah, so unfortunately, during the most unfortunate time, during the COVID pandemic, I was diagnosed with kidney failure. Yeah, so that was really bad. And I was going through a lot of life transitions at that point of time. So on top of kidney failure, the effects of kidney disease on the body, I was also working in healthcare. And I was moving house. And my daughter was starting her primary school. In Singapore, it's called primary school. So there were a lot of transitions, and I was having a lot of anxiety. So during the pandemic, I made a very difficult choice to quit my job. Yeah, to really focus on transplant. So because I already knew that my kidneys were going to fail one day, so I wanted to go through preemptive transplant.
Okay.
Yeah, which means to bypass dialysis. But because during the pandemic, the healthcare system was not operating as it should, so it took a very long time for my transplant to be arranged. So my husband is the one who donated his kidney, but not to me. So I went through a paired exchange transplant because we have blood type incompatible. Our blood types are incompatible. So they found another pair of transplant donor and recipient to do a swap so that it becomes compatible.
Right.
Yeah, so the risks are reduced, the cost is reduced, and the recovery is better. Okay. Yeah. So that was a very interesting experience. And along the way, he was told that his liver had issues. So the transplant was again disrupted, and I was so worried. So I went through a very difficult emotional time during that season. And after my transplant, I have another child. So now I have two kids.
Pre and post.
Yes, pre and post.
Wow.
Pre and post transplant kids.
Yeah.
Yeah. So one is 12 years old this year, and the other is 2.
Wow.
Yeah. So I went through motherhood all over again, and it was very tiring. And
so which one's your favorite child?
Both. I shall not answer that question. So I have the privilege of having the opportunity to work at the National Kidney Foundation in Singapore.
Okay.
So I decided to use my pain, turn my pain into purpose and use my suffering and sickness for good. So now I'm in the comms team.
Okay.
So I do a lot of
Fantastic.
communications work, but I am also a very strong advocate.
Okay.
So I'm doing advocacy in terms of research, medical education, and healthcare.
Oh, wow.
Fantastic.
It's really amazing.
That's great.
Yeah, so what Serene mentioned just now was that moon phase. And if you're wondering what that moon phase, it happens when you take a lot of steroids, and you can Google it. And I think all of us, to some degree, have had it. But Nicole, tell us a little bit about your story from Australia and your journey to
Yeah.
Yokohama.
Yeah, so I was diagnosed with chronic kidney disease at the age of 42. So I had 3 children, all teenagers at that stage, and I was unaware that I had any kidney disease until I got a sore throat. And about 3 days after having a sore throat, ended up going to the doctor, local doctor, because I was out of breath and my legs were all swollen and I just felt very unwell. And it turned out I had an EGFR of 7 at that stage, and that was the first we'd known about it. Hadn't had any other medical complications or issues ever. So it was a bit of a shot out of the blue. So they were able to treat the infection and settle things down, but my kidney function only went back to 22. So it turned out I had IgA nephropathy.
Okay.
And then what we did was a lot of, medications and all the things that we needed to do, correct diet, all of that. But unfortunately, then I got swine flu, which kind of tipped the balance over. And so I needed to start dialysis quicker than we thought that I was going to. So we made the decision for me to do peritoneal dialysis. I had a living donor opportunity, but unfortunately my daughter was in her last year of high school. So the most important year of a high school, and I lived in the country about 500 kilometres away from my nearest transplanting hospital in Australia. And so for me to have a transplant meant I had to be away from home for 3 months, which I didn't want to leave my 18-year-old daughter trying to study. So we decided that I would do peritoneal dialysis at home. So I did that for about 8 months, and then my little brother gave me his kidney in November of 2014. So we're about 11 and a half years, and it's been truly amazing. And coming to Yokohama, this is my 5th WCN that I've been to. I was first invited in 2019 to Melbourne. So the Policy Forum, I was asked to be the patient speaker at the Policy Forum. I was a physiotherapist prior to getting kidney disease, but I found it really hard treating patients because of being immunocompromised. I picked up colds and flus really quickly. So I was offered an opportunity to do a PhD at the University of Sydney. So in 2019, I started a PhD on rural and remote access and equity to dialysis and transplant for rural and remote patients in Australia. So I did that over 3 years and graduated, and then I spent some time in Central Australia. So I do a lot of equity research on how hard it is for anybody living outside of a metropolitan area to access care.
Wow.
So I was invited here to talk in the World Kidney Day ISN session about patient voices, and I've got a couple of posters and PhD students with posters that I now supervise here. So I'm kind of here with a few hats as well.
Oh, that's
Yes,
fantastic. So for me, really what happened was I've been working in media for about 20, 30 years or so. And so the biggest organization in Malaysia, that's where I'm from, cable television, you know. So I did all the sports commentary. I did sports. So in 98, I left to work with Formula One, with the Petronas team. I was doing a lot of work on Formula One. And just right out of the blue, when I was 35 years old, I was diagnosed with end-stage renal failure. You know, just feeling a little ill. I had a gig working on radio and on TV, and not feeling well, and suddenly felt sick. Went to see a doctor, diagnosed me with end-stage renal failure. Didn't know what that was. and didn't have access to a lot of information like we do today. Today there's Google.
Yes.
Yeah, but then there wasn't,
Yeah.
right? In year 2000, 2001. So just grasping at straws. I remember speaking to my nephrologist then that I knew, and I said, so where can I get some information on this? And he pointed me to his bookshelf and said, okay, I'll lend you that book. So I took it, but I didn't understand a word because it was a technical book, right? So there's nothing there that really explains it to the rest of us. So that was the challenge that I had as a patient then. And, so I started dialysis for about 10 years, which was absolutely harrowing. I used to be at about 85 kilos, and I just totally dropped my weight to about 62. So I was literally walking around like a skeleton. And from that point, trying to recover from that. And, I was on a dialysis chair. 3 times I almost died, almost flatlined, My nurses saved my life, right? And so I had to come back from that and, trying to do things, not having a job, doing all these things. And then I got married in 2011, met a wonderful woman, and she wanted to give me a kidney. So after we got married, she said, we need to look at this workup thing. And, me being in Malaysia, me working in media, still did not have any information on transplantation being done in Malaysia. She managed to make some phone calls, get somebody, got a referral to the hospital, and I go like, that hospital does it? I didn't even know. So we went, rocked up to the hospital, went into multiple tests for about 9 months, and then I got my kidney transplant in 2012, in June 26th of 2012, and it absolutely changed my life. And really what happened was suddenly I used to talk to my doctors and how is it you guys are doing this and nobody knows? Nobody has access to this information. So what we wanted to do was just pull this up, let everybody know about this. And we started talking about it and raising that awareness of it.
Yeah.
And, fast forward now, it's been 14 years of my transplant, and, God's blessings have been great in that sense that I'm able to do this as a patient advocate now. In 2013, I became a WHO-trained patient advocate in Malaysia. I lead one organization there, 2 now. And so we talk about awareness. So we go to the ground, we do different kinds of projects. We're climbing the highest mountain in Southeast Asia in May for the 3rd time. And this time, we've got 16 transplant patients.
That's great.
We have got kidney transplant patients, liver transplant patients, and a heart transplant.
That's awesome.
Right? And we're climbing that with doctors, and doctors who are here in WCN, which is absolutely brilliant. So we're bridging that gap between the patients and the doctors, and we're bringing them together to have these conversations, okay? We're going to take a quick break. We'll come back here with a slight change in the studio. Just for you. Okay, we're back like we promised, but we have got an addition. The former president of the Patient Liaison Advisory Group, a good friend of ours, Bill Wang, all the way from Hong Kong. How are you doing, Bill?
Doing very well, thank you.
Okay. Thank you for joining us here. But Bill, tell us, we were just talking about each of our stories and how we're here in Yokohama doing what we do. Share with us your journey.
Sure. My journey is a family journey. I have this genetic condition called polycystic kidney disease. It runs through my father's, side, and then, my sister and myself all got it, and then it's quite difficult psychologically because you see how your father suffered, and then your sister got diagnosed, and I did not want to think about it, and I did not want to know about it until I was diagnosed, and then you just have to deal with it, and until I got kidney failure, and I got a liver complications, and ultimately I have to go through a combined liver and kidney transplant. So my everyday life here is a gain. So I try to live the fullest, just like all of us. Yeah, thank you.
tell us a little bit about that procedure itself. You said that you had a liver and kidney transplant simultaneously at the same time. Tell
Yes,
us,
it's a combined.
combined. How did that happen?
Well, it's a procedure involves nephrotomy, just cut off one of the kidney and to make space, and then transplant the kidney, and then transplant the liver. So it was 14 hours, and by 14 doctors.
14 doctors.
Yes.
Okay.
And, on and off. And so they come in and out.
Surgery.
Yeah.
It's a big procedure. Yeah.
And so, who's the donor for your kidney? Do you know?
Well, it's a deceased donor. I don't know
Okay.
the identity, but very grateful to
And the liver?
the donor. It's the same donor.
Same donor. Okay, very fantastic. So you can see that each of us has a different journey, right? And but we're all here, and like Serene was just talking about what she does with NKF. Maybe expand a little bit on that with the National Kidney Foundation in Singapore.
Yeah, so I have always been in the healthcare sector since I graduated from the University of Melbourne. So I started off with, I have been and am still doing communications in NKF. So a lot of it is about awareness, education. So I'm overseeing like the social media for NKF Singapore. And of course, we have also publications. We do events where I write speeches. So all these are opportunities for us to really enhance the awareness of kidney health and kidney disease and the prevention of kidney disease. So, I mean, going back to we're talking about the resolution.
Yes.
Yeah.
Yeah.
So, it's very meaningful for me because I think there were a lot of gaps in my journey. I always say that I feel a little bit embarrassed because I have always been in the healthcare sector, but I know nothing about dialysis. Because in Singapore, although we have a lot of dialysis centers spread around the island, but they are usually, it's closed to the public because of infection control and privacy and things like that. So while we know that there are dialysis centers everywhere, but I didn't know what was dialysis. And even though I have the condition since I was young, and I knew that I would eventually have kidney failure, but to me, I've always thought that, okay, I have time, and a little bit like what Bill mentioned, I kind of was in a state of denial. I didn't want to learn more about it. I was just relying a lot on the doctor's advice and just following the treatments, which was also why I think that my kidney disease was able to last from the moment of attack to kidney failure. It was about 20 over years because I followed the doctor's advice to control my lupus and blood pressure. So now that I'm moving more into advocacy, in fact, I think it was just last year that I was really more involved in patient partnership. Yeah, so since 2013, I have been sharing my stories, it's just sharing what I have gone through, but I think being able to go one step ahead to say, hey, can we incorporate patient voices in processes and make sure that, it is truly a patient-centered healthcare system where our voices are valued and the nuances of a patient's journey is taken into consideration, because there are many things that without living with the condition, you will not understand. Yeah. So like for example, I have a perm calf. I don't have a fistula. So I did dialysis for 2 months.
Okay.
Yeah. So while I wanted to do a preemptive transplant, the stretch of preparation, I asked for the dialysis because I was afraid that I would get a heart attack if I didn't start.
Unwell.
Yeah. So I like to say that, I usually say that, like for a patient who is on perm calf, actually the fear is every single day when I step into the shower. But the healthcare workers may not know that is actually something that is, it can cause a lot of fear.
Absolutely.
Yeah.
How about you, Nicole? And what do you do in the advocacy arena now?
So I work a lot. We actually started our own charity because there wasn't anything for rural patients, and so I do a lot of advocacy work around peritoneal dialysis access. And so we, in Australia, the government provides the PD fluids and things, but there's some other things like a blood pressure machine, scales, things that you use at home that are not provided. So for about 8 years now, we set up a charity to actually support patients going through peritoneal dialysis so they didn't have to buy all of those things. So we look at the whole state of New South Wales at the moment. We provide every patient studying BP with that sort of equipment. And why that was important to me was that it was around making PD an option for people, because in the rural places, if you don't have a dialysis centre in your town, you've got to travel hours and hours. So a lot of my advocacy work is around rural and remote people and how we can make things better for them. But I also think the other part of advocacy for me is about screening, and it's harder for people in rural and remote areas to get into doctors and to see nurses and healthcare. So a big part around the resolution is that, screening is so important, and I think that gives us a really great platform to advocate to our governments. In Australia, we don't have a designated screening program. I was fascinated to find out in Japan that they do screening in children in all the primary schools, and I just thought, wow, like my IgA highly likely might have got picked up as a child in primary school. So I think, some of these platforms, we need to do more work around advocating for screening, strict programs within our countries to try and identify some of these ones that we can pick up early to sort of, like in Serene's case, like slow things down and actually put off that eventuality that you may need, dialysis or a transplant.
That's great. How about you, Bill? What do you do in that advocacy arena now? After your transplant?
It's interesting you mentioned the word advocacy, and people have a sort of, I think, a misperception of advocacy. I mean, when I say, I do patient advocacy, they say, oh, you have a very bad experience with your healthcare. I said, no. My healthcare team was excellent, but we have certain message that we want to convey. Not necessarily in an adversarial way, but in a very clear, strong, articulating way, so that the message is crossed to the stakeholders, the policymakers, and the regulators, and the healthcare workers, and through to our family members and to general public. So that's advocacy is about. Now, I'm a lawyer by training, so advocacy is part of my sort of DNA. Advocacy is not just in a courtroom. It's about negotiation. It's about persuasion. It's about compromise. It's get your message crossed. And also, very importantly, what message, at what time, and where, right? How, and that's advocacy. So,
absolutely. Yeah, great. We're going to take a quick break, and we'll come back with the second part of this as we unpack some of our stories. We'll come back with that. Okay. So what we're going to do, the second part is I'll tell my little quick story, and then we'll talk about the resolution itself, and how it impacts us in our country, and how we'd like it to impact us as well. Okay, right? Okay, so we're back with part 2 of this conversation, and Bill, we just heard from Bill talking about advocacy, and so my role right now is a person being in media and done that is trying to disseminate the information to the largest amount of people. And you know what both of you were saying just now about reaching out to the people is also very important to not look at ourselves as patients, although we are, but we are also the consumers of healthcare. We are the users of that system. And so we know it better. I mean, if you've got a car from a certain brand, you're using it on a daily basis, you know how it feels, right? So that's our role there. And also as voters, because we are the people who vote the politicians into place because they promise us certain things, but we are also the taxpayers. We pay the tax, right? So if the government of any of our countries don't take care of us, and then we are ending up sick, we're taking from the system. And as we can see that all of us, now that we've had our transplants and we're well, we are giving into the system. So it's also important to wear those hats, right? And explain to people in healthcare as well that we wear those hats. We're not only a patient.
Right.
We're not only an illness. Right here, sitting down here itself, you can see a communications expert with healthcare in the background, a physiotherapist with that background doing fantastic charity work. You're seeing an advocate, a lawyer advocating for a lot of things, and you're seeing another media person doing this, So these are the different hats we wear, and we are in different rooms. All of us have been in different rooms that are sometimes inaccessible to people only in healthcare. Clinicians who are sitting down and working in hospitals. Because, some of the stats that we have, right? There are 8.4 billion people in the world. There are 65 million healthcare professionals. Everything, 65 million people taking care of 8.4 billion. It's just impossible to even think of it. But they are patients. They are users, consumers like us, who are now advocates for the system. And we're not against the system, but we, just like what Bill said, we've seen the great things that our doctors and our hospitals do, and then suddenly realize, how can we do this better? How can we serve more? How can we reach more? How can we help more? And that's, the mantle that I guess all of us are wearing that and saying, okay, we want to push this envelope a little bit. And as we're talking about that, now we've got this kidney health resolution that has just been passed by the WHO, and congratulations to ISN for finally getting it across the line. And this resolution is really making it important to WHO that kidney health is important, because diabetes could lead to kidney disease. And then a kidney disease is debilitating and is very, very expensive for any health system. And for families, it leads to a lot of rot. And so how do you feel that kidney resolution has impacted you and can impact you better in Singapore and your fellow citizens?
Yeah, so in Singapore, the National Population Health Survey in Singapore showed that 14.9% of people aged 18 to 74 have chronic kidney disease. So that translates to about more than 500,000 people currently in Singapore who have chronic kidney disease. But I think back to your point about screening. So that's something that we at NKF, we are really very passionate about and driving a lot for in terms of prevention. Yeah, so in the recent World Kidney Day campaign, we actually have, we ran a campaign it's called Saving 1 Million Kidneys, where we have a tagline that says, he feels fine, but his kidneys may not be. So a lot of times, I think you mentioned, right, like you didn't know, and then you also had just swelling, but all these things could have been happening in your body for years, and you don't even realize it. So in Singapore, we have, the Ministry of Health in Singapore is working very hard in terms of preventing chronic diseases in general. So that includes diabetes, hypertension. But I think with the resolution, it really places kidney health and kidney disease as a priority. So we are not like, just because you have a diabetes and then it leads to kidney disease, but kidney disease itself is something that is very important, and we are driving towards it. So now we work with the general practitioners in Singapore to have people look at themselves and say, okay, how many risk factors do I have? Do I have the risk factors? And proactively ask the doctor for a screening. And I think what NKF does is really to come in to support people who are at risk to have the screening done. So I think the work that we are doing right now in NKF Singapore is really quite meaningful in that sense, to help to prevent what we call a kidney tsunami from happening. So so if the kidney tsunami comes, there's so much devastating effects, right? And me as an advocate, when I speak to someone, just a random person on the streets, I can tell them that, it's really, really tough to have kidney failure. I had to quit my job. I was tired all the time, and I wouldn't want anyone to have kidney failure. Not even my worst enemy, you know. Like, so me being in a position of someone who has gone through it and have suffered so much, we are in the position to say that, you know, we want to do more to help people not have kidney failure. And then the other part, apart from screening, I guess is, I mean, I'm in comms, so education is of course really important. And the other thing is about transplant. It's about getting people to consider living donor kidney transplant and to have that conversation going. Because, I mean, there's dialysis, there's peritoneal dialysis, there's hemodialysis, and there's transplant. So I would like to advocate that the conversation kickstarts with transplant as the first option because of the best clinical outcome.
Yes.
And if that's not possible, then you can look at then what is the better dialysis modality that suits your lifestyle. Yeah, so that's for me.
So that is in a nutshell so many things already, you know. And Nicole, how should the resolution impact what you do, and you know, how do you think it should?
I think the really important thing for me was how it, you know, a lot of medicine is dealt with in silos. And what this has actually done is it's actually taken away the silo and incorporated chronic kidney disease within the spectrum of that, you know, NCD world, and elevated it to be an equal partnership with things that the world already knows are, you know, complicated, life-threatening, life-shortening kind of diseases. And so for me, I think that's the really important thing, is that, you know, the inextricable relationships of chronic kidney disease is not something alone. And, you know, Bill encapsulates that, you know, with his disease, it was liver and kidney. You know, those of us who might not have diabetes prior to a transplant may end up with type 2 diabetes due to our medication. Or you may have had diabetes going into the transplant. So, you know, our relationships with cardiovascular, kidneys, and, you know, the endocrine system, that they're integral. So by actually including this resolution, looking at things not in a siloed perspective, I think is really important, because we need to move away that, you know, we've got kidney disease. Most of us have other things as well going on. At some stage we're going to, definitely. And I think the more the world is aware that we're a part of that story, not just out here by ourselves, I think the more important it is. So for me, that's what that did. It really broke down some silos and kind of elevated chronic kidney disease awareness and education onto that same platform as those other chronic diseases that were already there.
I like that word, silos. You know, we need to break those silos. We absolutely need to break those silos.
Absolutely.
For you, Bill, in Hong Kong.
I think it's not Hong Kong or non-Hong Kong thing. It's a universal. I think, you know, as an advocate, as a patient partner, you know, when we do the advocacy, we look at our landscape, right? Who are we trying to convey our message to? What kind of resources we have? What kind of toolkits we have? And who are our alliance? And guess what? This resolution is a powerful tool we can utilize, right? And WHO is on our side.
Absolutely.
Right? And WHO has its own credibility and the impact. And so that's just helping us. And the other thing is, we patients ourselves are resources. And so we put together all the resources, the resolutions, our allies in healthcare sector. We try to bring the policymakers to our side, and we think through how do we effectively get our message across. And the message is important, and everybody alluded to, is we need to move that kidney care upstream, rather than just downstream, kidney failure and transplantation. Hopefully we will move upstream, and before that happens, everything happens.
We're coming up to the end of our time, so I'm just going to wrap it up, and I'm going to ask you for your final thoughts on this. But, you know, very importantly, the silos, you know, in this room itself, listening to us, we've all had kidney disease, but from different places, different times, different ways, different conditions that brought us together. We're in this room. We are not a silo.
No.
We are not in a silo. So, and it's important for us to also remember that the Ministry of Health, now the word Ministry of Health, the Ministry of Transport in our country has a job. Every one of our countries has a job of connecting people from one place to another, whether you can fly there, take a boat, or drive a car. So that's the purpose of the Ministry of Transport. The Ministry of Defense protects the country. The Ministry of the Health cannot only work in a hospital when people are sick.
Yeah.
Then it becomes the Ministry of Sick.
Yeah.
Right, it's health that they are supposed to promote. And this is where we as patient advocates are coming along and saying, we've been ill, now we are better, we are well. Use our voices to perpetuate that, to push that agenda so that people get more screening, are talking to each other, are aware of the data that is there. Use our different expertise in advocating for this so that get the word out there. Because our clinicians are inundated with taking care of sick people.
Yes.
And that's a great job that they're doing. They don't have the space or time to walk outside the hospital, outside those silos.
Yeah.
Right? And we are outside that silo. And that's where the PLAG, the Patient Liaison Advisory Group, is very powerful in the sense that we've got that diversity. We've got a common goal. But we've got that diversity to be able to reach out to a lot of people. So any final thoughts, Serene, from your end?
Yeah, I think the patient advocacy and the patient community is so important because I just had a session that I attended, which is like what patients tell nurses but not doctors. But at the back of my mind, I know that patients are talking to each other,
Absolutely.
right?
Yeah.
And then what is the role of an advocate is really to make sure that, they are well supported, like patient to patient is always more powerful. And if I am equipped with the right knowledge, then I am able to then support my fellow patients in the right way. Right. And to really get them to access the right resources. So I think, so the things that we are doing right now, I think it's really powerful, and that I am hoping that the kidney patient advocacy can really grow as well. Yeah.
Absolutely.
So, yeah.
Nicole?
I'm just thinking that this is a really vital conversation. We've got 4 countries, 4 experiences, 4 things. I think we actually need more of this when we come to WCN as well.
Yeah.
Not just attending it, but I actually think getting all of us patients together in a room with experience and sharing, what are we learning, what have we done, and how do we want to go forward, and what stuff do we want to take that you're doing in Singapore, Malaysia, and Hong Kong that, in Australia I can learn from, and how I can go about that, and vice versa. So that's probably my last word, is that I think we need to do more of this, talking together.
Bill?
I think we need to upscale our game, really. I try to get into all these rooms and learning a lot of things. I need to learn their language, and we advocate that, clinicians and learn our language, knows patients and knows our world. We need to know their world too. And that's a very important part of advocacy. Just know your counterparty, know who you're dealing with, and learn that language and try to understand. If you don't understand, just ask questions, and so that you're better equipped. And I'm a big fan of patient capacity building, because we're not just at the level just say, create this misperception and say advocacy is just complaining. No, it's not.
No, it's not. Yeah,
it's
absolutely.
not. It's based on your own experience, based on your knowledge, based on your personal journey and experience, and you get your message crossed, and that's advocacy.
You've encapsulated it very well. Thank you so much. And so now, if you're watching this, this is your duty. Share this video with all your fellow nephrologists, so that the next time the WCN comes along, we've got a bigger group of patients, a little bit of a bigger room, whatever it is, we sit down here and have this conversation and probably come out our own resolution.
Yes, I agree.
Yeah, thank you so much, Nicole.
you.
Thank you.
Serene.
Thank you.
Great to have you here. We'll see you at the next WCN. Cheers, bye.